Though there's been an increased awareness around menopause in recent years, our knowledge of this life experience that happens to half of the world's population is still severely lacking. While menopause is often thought of as a reproductive condition, its effect on hormones has significant impacts on the rest of the body. In fact, scientists are now researching how this health event influences other areas such as the brain, nervous system, and cardiovascular system. Dr. Priya Freaney is a cardiologist and director of women's heart care at Northwestern Medicine Bloom Cardiovascular Institute. While there are various lifestyle factors that increase heart risk as we age, she says the biological changes that occur in women during menopause are a real threat.
By definition of menopause is the time when the ovaries stop producing estrogen. And estrogen is protective to the heart in different ways. So as that natural estrogen declines, there's a lot that can happen where the arteries stiffen, the cholesterol rises. Things like LDL cholesterol and apolipoprotein B can increase by up to 20% in just the few years around menopause. Blood pressures worsen, metabolism slows down so that it's easier to gain weight, body fat shifts to the belly. So all of these things together can drive this increased risk for heart disease around the time of menopause.
Research shows that this risk heightens even more for women who begin menopause earlier in life, which is at or before age 44. Despite this knowledge, many women are still unaware of the danger they're in as they enter this new stage in life. In fact, some of the telltale signs that something's not right are often overshadowed by the many common symptoms of menopause, such as hot flashes and sleep issues. Freaney says oftentimes women may not even realize the symptoms of heart disease for what they are because they can present differently in women than the ones we typically hear about, which are specific to men.
You often think about crushing chest pain, elephant sitting on your chest, which can happen in women. But other ways that heart attacks can present are nausea or shortness of breath or arm tingling or pain or jaw pain when you're moving around. A lot of people around menopause have palpitations or extra or irregular heartbeats that can be bothersome. That's something to look out for and talk about if it's bothersome to you.
A 2023 paper published in the Journal of the American Heart Association reveals that 1 in 4 women may develop irregular heart rhythms after menopause. This irregularity, called atrial fibrillation, can lead to blood clots, heart failure, and stroke.
And then going back to presentations of various types of heart diseases, heart failure, which is when the heart pumping function isn't working well and you can accumulate fluid retention in the body, can present leg swelling or trouble breathing when you're laying flat to sleep at night.
This difference in symptomology is important to know so that any warning signs can be caught early and treated appropriately. When discussing treatment, a question that gets asked is, what about hormone replacement therapy? HRT replenishes a woman's estrogen and sometimes progestin to help combat common symptoms like night sweats, bone loss, and hot flashes. And if it's the change in hormones that's ultimately causing many of these increased risk factors to heart health, shouldn't giving women additional estrogen fix those issues? Freaney says the various research surrounding this treatment has created a roller coaster of recommendations throughout the years.
Many years ago, it was that everyone should get it, then it was no one should get it. Now we sort of take a more nuanced, individualized approach of who to give menopause hormone therapy to and why. There's one, people say, your estrogen's declining and it's worsening your heart health. So if you just give estrogen back, shouldn't that solve the problem? But we have very clear data that says we don't treat heart disease after menopause with estrogen or with hormone replacement therapy. So we treat the risk factors and heart diseases in many other ways, but we can make an assessment of whether hormone therapy is safe for the heart if it's needed for other reasons like vasomotor symptoms, hot flashes, night sweats, sleep disturbances, things like that.
But Freaney says women who've already experienced a heart attack or heart failure are advised to avoid hormone therapy because it can actually increase the risk of blood clots, inflammation, and fat in the blood.
This is in individuals who have existing heart disease. This is giving hormone therapy back, right? Not natural estrogen, but giving hormone therapy back to those who have had heart attacks can change the vessel lining in a way that can propagate additional clot in the arteries.
Freaney notes that replacing natural estrogen with synthetic HRT is not an equal substitution. On top of that, additional hormones won't be able to fix the damage already done, such as high blood pressure, stiff arteries, and high cholesterol.
symptoms of heart disease or the risk factors for heart disease have to be treated with other evidence-based methods that we have for that. So the cholesterol is treated with lifestyle and or cholesterol lowering medications when appropriate. Blood pressure should be treated with lifestyle, sodium reduction, dietary changes, exercise, and blood pressure medications when needed. And there are other evidence-based approaches that we know work really well to lower risk factors and heart disease that we should, really hone in on more around the time of menopause.
Freaney says today, patients have a lot of options to pick and choose which treatment will work best for their individual issues. But while medicine has come a long way, she pushes for people to focus on prevention when it comes to their health, especially their heart health.
I tell all women that they can have a focused conversation with their doctors about mapping out their risk factors for heart disease at any point in adult life. It's never too early to have that conversation about what is your blood pressure, what is your cholesterol, what is your lipoprotein little a, if that's something that your doctor thinks is relevant to measure. What are your family members dying of, or what are the heart diseases that the family members have had? And how can all of that be taken together to map out a plan for you to treat or lower heart disease risk?
Since most women don't experience menopause until their late 40s or early 50s, it may seem unnecessary for women in their 20s to begin tracking their heart health. However, Freaney notes that heart attacks don't often come out of nowhere. It's usually an accumulation of risk factors that pile up over the course of 30 or 40 years, which means that what you do today has a direct impact on your older self.
So it's really never too early to start the conversation. We should start getting your blood pressure and cholesterol checked at age 18 when you're talking about adult medicine. And prevention conversations can happen at any time. When you talk specifically about menopause, I think that the decade prior is a good time to sort of brace yourself for the changes we've described about menopause. So in addition to cardiovascular exercise, which we all should be doing at least 150 minutes of every week, women should incorporate 2 days a week at least of strength training to get ahead of the muscle mass loss that happens at the time of menopause. Incorporating healthy eating practices prior to menopause onset if you can, so that it's part of your daily routine, so that when you have sleep disturbances and mood disturbances and don't have as much energy to be cooking well, it's already part of your practice and you can continue that. These are some of the tips and sort of timeline considerations about why it's important to get started early with bracing oneself for menopause and the changes that are to come, and not thinking that this is sort of the end of heart health, but rather a good time to take charge of your own heart health.
You can find more information about Dr. Priya Freaney and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.